Our new curriculum here at IU School of Medicine is going to draw from the fantastic opportunities that we have based on our 9 centers around the state. There are unique clinical experiences that are available in each of our different centers.
One of the critical elements is that all the people that are a part of this are the people that are teaching directly in the classroom. The other thing is in the clinical environment, we've brought in clinicians that have been preceptors for many, many years that have been a part of this process.
What's most exciting about having the students involved in the curriculum renewal effort is the level of interest they have in creating something bigger than what is already there.
One of the key strengths of the new curriculum is the integration of the foundational sciences with the clinical components. And what this really provides for students is context. The second thing we're very excited about is the nature of the learning methods.
In the new curriculum here at IU School of Medicine, we will be using more clinical applications earlier during the first and second years in those foundational sciences to allow students to better apply the concepts that they're learning.
IU is really well known, I think, for having a lot of patient interaction. And I especially get that here at Muncie, where we're so close to Baltimore Memorial Hospital. And just getting to go see patients every week or so has really helped me remember why I wanted to come to medical school.
This new mentoring and advising system allows us to mentor and advise our students starting from the very first year as they start out with us in how to matriculate as a medical student through our program and also how to start to think about what their careers might look like.
I think the advising and mentoring is huge because I don't think I would be here today if it wasn't for some of the mentors that I've had along the way.
Increasingly, we realize that medicine is not an individual sport, it's a team sport, and involves many different healthcare professionals that lead to effective diagnosis and treatment and preventive care.
I think one of the biggest challenges as physicians is to work with the overall care of the patient, and that requires nurses, PAs, physical therapists, and if we learn how to communicate with them and know the different skill sets, we can encourage more interaction between the disciplines to get the patient the best care possible.
The Teaching Electronic Medical Record is something that allows our medical students to see how things play out in the real world, so to speak. And hopefully what they'll be able to do as they work through the Teaching Electronic Medical Record is ultimately learn these best practices for patient safety and really quality healthcare delivery.
The teaching EMR is great. It's given me a chance to really learn what physicians are going through when they're looking at patient data and how to best serve the patient in the most efficient way.
One of the key elements of our new curriculum at IU School of Medicine is to integrate the 6 competencies throughout the course of our curriculum. These competencies will be thoughtfully integrated into each course from their first year of medical school through their 4th year of medical school.
Information changes so rapidly, and there is an absolute need for physicians to be able to find out what they know, find out what they don't know, and to be able to find the resources to fill in those gaps in medical practice as things change. So one of the emphasis we have in this new curriculum is to make sure that students have the tools that they need to become lifelong learners.